Hai teman-teman, apakah kalian sudah pernah dengar penyakit chronic kidney disease? Jadi teman-teman, chronic kidney disease atau penyakit ginjal kronis adalah kondisi saat fungsi ginjal mulai menurun secara bertahap. Penyakit ginjal kronis disebut juga sebagai kerusakan ginjal dapat berupa kelainan jaringan, komposisi darah, dan urin atau tes pencitraan ginjal yang dialami lebih dari 3 bulan. Ini adalah contoh gambar dari ginjal normal, gagal ginjal, dan juga gagal ginjal kronis.
Chronic kidney disease, CKD, is a gradual loss of renal function, typically developing over the course of months or years. Many conditions, both within and outside the kidneys, can cause progressive damage to the kidneys over time, leading to CKD. Of these, most common are diabetes and hypertension, both of which directly damage blood vessels within the kidney, destroying renal tissue. An acute kidney injury, if not completely resolved, may also become chronic kidney disease. The severity of renal disease is evaluated based on glomerular filtration rate, GFR, an indicator of how well the blood is filtered by the kidneys. GFR is calculated as a function of serum creatinine, a waste product that accumulates in blood plasma when renal function declines. The calculation takes into account the patient's age, gender, and race. Symptoms develop slowly over time, progressing from renal insufficiency to end-stage renal failure. Often, initial loss of renal tissue does not produce any symptoms because the remaining healthy tissue becomes more active and can temporarily compensate for the loss, a phenomenon known as renal adaptation. Symptoms appear when a significant portion of kidney function is already lost. The ability to concentrate urine is usually the first to be impaired, resulting in frequent trips to the bathroom, especially at night. Other early signs include fatigue, loss of appetite, and decreased mental ability. Because the kidneys remove metabolic wastes, control blood pH and fluid electrolyte balance, as well as produce several hormones, loss of kidney function may result in a number of complications. Accumulation of toxic nitrogenous waste can cause a range of symptoms, from nausea, vomiting, to confusion and seizures. Reduced excretion of hydrogen ions leads to increased blood acidity, or metabolic acidosis. Reduced excretion of potassium results in potassium overload in the blood, or hyperkalemia, which may cause cardiac arrhythmias. Hyperkalemia usually occurs only in advanced stage, but excessive potassium intake or use of drugs that prevent potassium excretion may precipitate the condition in earlier stages. Decreased excretion of phosphate results in hyperphosphatemia. Reduced renal production of calcitriol, an active form of vitamin D, contributes to low blood calcium level, or hypocalcemia. Low blood calcium stimulates production of parathyroid hormone, PTH, by the parathyroid gland. PTH promotes calcium release from bones in an attempt to raise blood calcium. This sequence eventually leads to an overactive parathyroid gland, or secondary hyperparathyroidism, which can develop before hypocalcemia occurs. As the bones continuously lose calcium to the blood, they become thin and weakened, a condition known as renal osteodystrophy. Symptoms include bone and joint pain and increased risks of fractures. Reduced renal secretion of erythropoietin, a stimulating factor for red blood cell formation, can lead to anemia.
Teman-teman, gejala klinis dari penyakit gagal ginjal kronis ini ada 8 menurut Suryono 2001, Dalamnuari dan Widayati 2017. Yang pertama, gangguan kardiovaskuler. Yang kedua, gangguan pulmonal. Yang ketiga, gangguan gastrointestinal. Yang keempat, gangguan muskuloskeletal. Yang kelima, gangguan integumen. Yang keenam, gangguan endokrin. Yang ketujuh, gangguan cairan elektrolit dan keseimbangan asam. Dan yang terakhir, sistem hematolog. Jadi teman-teman, komplikasi yang ditimbulkan dari penyakit CKD ini menurut Baumann tahun 2000 dalam Prabowo tahun 2014 Yang pertama, penyakit tulang. Yang kedua, penyakit kardiovaskular. Yang ketiga, anemia. Dan yang terakhir, disfungsi seksual. Penyakit gagal ginjal kronis adalah salah satu jenis penyakit tidak menular yang memiliki angka kesakitan cukup tinggi, namun teman-teman bisa mencegahnya dengan cara yang pertama, teman-teman bisa mengendalikan penyakit diabetes, tekanan darah tinggi, dan juga penyakit jantung dengan lebih baik. Mengurangi makanan yang mengandung garam adalah salah satu jenis makanan dengan kandungan natrium yang tinggi. Yang ketiga, teman-teman harus banyak minum air setiap harinya. Dan yang terakhir, teman-teman jangan menahan buang air kecil ya. Teman-teman, semoga video kami bisa memberikan manfaat dan wawasan yang lebih luas lagi buat kalian tentang penyakit gagal ginjal.